Good morning, everyone. I just want to take a minute to say thank you to everyone for coming to our case conference this morning. It's really great we could all get together to have this conversation, and I'm really looking forward to what comes out of it today. So I thought we would start with some introductions. On the end, we have Mrs. Apple, who is Lucy's teacher at Prince Charles School. We then have Hope, who is Lucy's older sister. We have Lee in the middle, who is Lucy's babysitter, but also a very close family friend of Mom, Hope, and Lucy. She can be considered an extended member of the family. We then have Lucy, who we're here to talk with and figure out some supports moving forward with her life. So we're really looking forward to that. And then last but not least, we have Mom, who is the biological and sole support parent of both Lucy and Hope. So my name is Kristin, and I work at Highland Shores Children's Aid. I'm the child and youth care practitioner within the agency. I've been working with the family for the past 4 months. We actually got a call from Mom who wanted to do a self-referral on a voluntary basis. Mom was concerned of the level of parent-child conflict within the home and really wanted some support moving forward to help with that conflict piece. From talking with Mom, she has also said in prior conversations that there is concern of Lucy's mental health and some speculated behaviors that are related to a potential mental health diagnosis, and that she wanted support moving forward with that as well. So I'm working with the family on a voluntary basis and will continue to do so as long as the family wishes to have our support. I also want to thank Mom for letting us into her home today. Mom has said she doesn't drive, so coming together in the home was the best place and most comfortable for the family, so thank you for letting us in. It's been really, really helpful getting us all together in one spot. So to start our conference, I thought I would start with a look at the ecological perspective that Lucy is within her life. So if we picture Lucy at the most center of this ecological map, we can see that the people here today, aside from the doctor who couldn't join us, is the closest within Lucy's ecological circle. So these are the people that are most impactful on her and she interacts with on a daily basis. On a broader circle, the family is being supported by some agencies, including Children's Aid, as well as Mom is getting her own mental health and counseling support. We can also see some indirect support from the Hastings Prince Edward District School Board, and there are interactions with the landlord that looks after the housing for the family. The family does live in a town called Trenton. They generally live in the lower income housing spot of the community. This part of the community is known for higher crime rates as well as a lot of working families. So we'll just be aware of that moving forward within our planning. So next we'll kind of take a look at the risk and protective factors of Lucy's development. We've all had a chance to talk and come forward with the list that I've compiled here today, which is really awesome. So we've kind of mapped out the top ones. So first we'll look at the top protective factors within Lucy's proximal environment, which is the environment most close to her and affects her in a very direct manner. So we've listed that the healthy, caring relationship between Mom and Lucy is very protective, as well as that Lucy has a very good relationship with her sister, and together the family is very well connected. We can also see Lee is a huge protective factor. She's not only a babysitter to Lucy, but is also a very good role model for positive life skills, such as hardworking, doing cooking, learning the principles of a job, and all those types of things. Lucy also has no attendance issues with school. This is one of her favorite environments, and she looks forward going there every day to have social interactions with her teacher, Miss Apple, as well as friends, which is really awesome. The school is also very well supportive of Lucy and family. They were the ones who came forward to Mom with a suspected diagnosis of ADHD. So together they have worked really, really collaboratively to start that process and getting the assessment rolling with the family doctor. So on the more distal side, we can see that Mom has a lot of strengths. She's actually always willing to implement any strategies that are suggested by myself or the school, and she states she'll continue to do that if we have involvement with other agencies. Mom is also looking after her own mental health and getting counseling for those pieces to be a more positive parenting role for Lucy and Hope. Hope is also in some self-esteem groups, which though Lucy is not directly affected by those, she does come home and witness kind of this, the skills Hope is displaying in terms of role modeling and positive social interaction, which is really great for Lucy's development moving forward. So in terms of risk factors, we have highlighted some top risk factors. So the first one we can look at is the emotional regulation. Lucy experiences struggles with her escalation of anger, which often results in the harm of herself by kicking or punching walls and things like that. We can also see the level of conflict within the home is quite high on a regular basis. And as a result, there's a low ability to manage that conflict in an appropriate way, which does lead to have high stress on everyone in the family. Mom tends to struggle with enforcing rules within the home. She often questions her ability to parent the girls in an appropriate way, as they often don't follow the rules. And lastly, we can see the potential diagnosis of ADHD as a risk factor to Lucy and affecting her development if not looked after properly. On the more distal side of the risk factors, we can see that the low and sole support parental income will limit the interaction we have with specific agencies. There's also no support, financial or parenting from the maternal or paternal extended family. So mom is the sole support parent, which in times this can be quite stressful as there's no respite to take care of herself. And the last risk factor we can see on the distal side is driving. Mom is quite confined to the services within Trenton unless there is transportation provided to an outside community. So based on the risk and protective factors that we've talked about here, we can kind of look at 3 priorities for intervention and prevention that we want to look at in supporting Lucy moving forward. So the first one that I'm going to suggest is mental health support and intervention. So with the goal that Lucy will be able to better understand her diagnosis, but will also learn some strategies that will help her focus in the classroom as well as at home. And as well that these strategies implemented will help reduce the stress experienced by mom with the behaviors that Lucy is showing in relation to this potential diagnosis. So I'm going to suggest using the Children's Mental Health Services to provide individual mental health counseling as well as family-based counseling to provide strategies moving forward with this diagnosis. They're also great for community collaboration and ensuring that the school is on board with any strategies that can be used in the home and at school. So the next priority that we're going to look at is the emotional regulation skills and the escalation of anger that Lucy experiences. So hopefully with this support, Lucy will be able to understand her anger and be able to implement strategies that help bring her back down and reduce the risk of hurting herself and others. So I'm going to suggest 2 supports for this, which is the Child and Youth Care Practitioner within the school board, as well as Children's Mental Health Services. So the Child and Youth Care Practitioners of the school board right now are really looking to implement self-regulation within the classroom. So if we can have Lucy introduced to that, that would be great. And then Children's Mental Health through the individual counseling and in-home support can provide strategies to help Lucy with this portion of her emotional regulation. And last but not least, the final support is actually to help support mom, which will support Lucy in a more indirect manner. So what we want to do for mom is bring home some in-home parenting support intervention for mom. So with that, we hope the goal will be that mom will be able to enforce rules in the home and regain her power as a parent. And she'll also be able to manage effectively within conflictual situations and also use appropriate conflict resolution skills with Lucy and Hope. So I'm going to suggest using Clinical Support Services program that is funded through the Children's Aid Society. This program is an intensive in-home support where a independent worker will come in and work with mom as well as the family to help with parenting strategies and help manage behaviors and enforcing rules and all of those elements right in the home. It's a really, really great support. So a couple things that are going to maybe slow or impede our movement forward with these plans is the element of transportation. So transportation is actually going to be looked after by our agency to get Mom, Lucy, and Hope to the Children's Mental Health Building in the next town over, which is great. One big thing we will have to worry about for both the Clinical Support Services program as well as Children's Mental Health is the wait list. The wait list can be quite long, but we will get that referral in today, so the process is moving. In terms of Children's Mental Health, there is a walk-in clinic that's offered every Wednesday from 1:30 till 6, and it's right in Trenton, so you guys can utilize that support in the meantime until we are seen by the actual larger organization. In terms of Clinical Support Services, their waitlist is a bit shorter, so we can hopefully work together to implement some strategies in the home until we have that worker come in. Other than that, things should move quite fluidly forward in terms of getting the support from the school board as well as working collaboratively. This is already a really huge step, so we should be able to move past those slight factors that will slow our movement forward down, but we will get there, which is the main thing. So that kind of brings our case conference to a close. We've discussed many things and have developed a plan moving forward, which will hopefully work in Lucy's best interest in terms of her development, her behaviors and interactions with the family. So hopefully we can get together again. I thank you guys for all coming and having this conversation with me, and hopefully we'll connect later on.